Cosmetic Surgery Forum has been a wonderful meeting this year. I personally spoke about scars, where we see patients who may have had a skin cancer surgery and may have had a traumatic scar. And we are tending to treat scars earlier and more effectively by using these fractional ablative modalities to zip over scars. We can improve texture. We can also improve erythema. Sometimes we'll actually jump in there and use something like a pulse dye laser as well.
I talked about radiofrequency microneedling, specifically the Infinity device, and how it works with acne scars, and specifically acne scars and skin of color. So one of the things I always look for with skin of color is, first of all, safety and making sure that I'm not making the condition worse. It's very important with skin of color to make sure that you are preventing hyperpigmentation, post-inflammatory after any kind of procedure. It is also important to make sure that it's efficacious, because if a patient is going to go through a procedure, we certainly want to make them improved without causing harm.
I want to talk about scars and how important it is to pay attention to our acne patients and to fill in those scars, even if it is the use of microdroplet silicone, which I went into in the meeting about how to use a tiny little flashlight to get the side lighting, and then to create these little tiny microblebs. And it applies to any one of these acne scars. It can be stretched, and anything that can be stretched to look normal is gonna fill up nicely with that agent when appropriately and subtly applied on a repetitive monthly basis. I also talked about Z-plasty, a wonderful underused technique which allows a linear scar to break down into multiple little channels and reduces the visibility of a scar dramatically in sensitive areas, especially when you're trying to release the tension on that scar. You can unbind it and lengthen the wound with Z-plasty. So those are my zingers. Thank you to everybody who made today's meeting possible. Thank you very much.